So in this video, we're going to go over how to integrate the reusable restraint into the stretcher and how to deploy it. The reusable Velcro restraints are color-coded on the packaging, as you can see, the blue for sky or wrist and the green for grass or the ground. So when you install these, it's important to have the label facing the provider when they're installed. And what this does, it allows, so when it's deployed from the cuff securement strap, it allows access to the front buckle and to adjust it. So that's done. And now we're going to move to the left wrist position. We want to go over the upper lift bar on the patient's left side. We have moved all of our wrist restraints on the left side because most ambulances have the wall on the right side, so we want to have easy access to that. So now we're going to go and do the final one, which is the right wrist position. So the installation is complete. We're going to go over the reusable restraint and how to apply it to the patient. And we're going to start with the ankles. And when it's time to deploy, you can move the anchors out to the ends. We're going to release the cuff securement straps to release the restraints. So we're going to remove the rubber band and break the seal on the back. That will release the restraints. You will notice that our ankle restraints are also color coded with the Velcro and are a little bit shorter since the distance is not as far. So you're going to want to connect the black hook and loop portions first, followed by the green hook and loop portions. And you want to crisscross the restraints. This helps eliminate further motion and will prevent these straps from sliding down on the side here. Now we're going to go to the other end. We're going to pull the tab to tighten. Now once those are secure, the patient is immobile. If time permits, you can tie a half hitch in the strap at the buckle for further security. But it is not needed. Once they are tightened down, the buckle will not slip. Now we're going to move to the wrist restraints. We're going to start with the left wrist restraint. You always want to come in from the side here and not between the foot lift section and the frame of the stretcher so you don't pinch your fingers if they're kicking. Now you'll notice that the strap on the wrist restraints is a little bit longer because of the distance it has to travel to the upper extremities. We have also color coded our Velcro with the wrist restraints. Again, we're going to attach the black hook and loop portions first, followed by the blue hook and loop portions. Pull the red tab to adjust, remove the slack. You want to ensure that you do not have too many twists in the strap when you apply it to the patient to eliminate any chance of it jamming in the buckle. Again, if time permits, you can tie a half hitch. So now we're going to go to the right wrist restraint. If you have any excess, you can tuck it under the stretcher mattress. Now you want to ensure that you have two tight finger spaces between the neoprene and the patient's wrist. This does not affect circulation. And you need to continually monitor these types of patients. So if the patient's separated from the stretcher, you can easily access the restraints and remove them from the stretcher. Move it onto the backboard. It's pretty simple. This works with most hospital beds as well. You're ready to go. That's it. Okay, so after you use the cuff, for mild contamination, you can use a disinfectant wipe. You want to make sure that you thoroughly dry it before you re-roll it and package it. For moderate contamination, you can either use bleach or machine wash. And for gross contamination with blood or bodily fluids, we recommend disposing of those. Now, we recommend that you use these restraints 10 times. We have a tracking sheet on our user guide, and we recommend that due to the plastic buckles. We want to ensure that the strength continues to be there for medics. So once it's thoroughly dried, we're going to start with the loop end first. We're going to start folding. Simply just bring the strap back around with it. So we reconnect this to the stretcher anchor, and we're going to reconnect it back into the cuff securement strap.